Chapter 8, learning and behavior disorders. Guess what? This is what you're probably going to encounter the most. So, attention deficit hyperactivity disorder has been studied for more than 50 years. The American Psychiatric Association finally decided that it has three patterns of behavior: predominantly hyperactive, impulsive type, the predominantly inattentive type, and the combined type. And I bet you're thinking, ooh, I know kids that have all of those. And they may or may not have been diagnosed with ADHD. Some of those things are also developmentally appropriate for different age groups, right? Impulsive and hyper 2-year-olds, right? But when it is a problem is when it is beyond the scope of typical. So when you're defining ADHD, you have to rule out other causes. Is there a physical reason why this child can't control themselves, that they're having impulse control or they're inattentive? Maybe they can't hear very well. Clinical assessment of development, as well as academic, social, and emotional abilities, checklists, and rating scales. So there's a lot of ways of looking at children's behavior to determine whether it is indeed ADHD. Causes are unknown, possibly genetics. If you have one or more parent who is hyperactive or who has ADHD, there may be a higher chance that you are going to have it. Smoking or drinking during pregnancy may be a factor. Things that accompany ADHD, learning disabilities. If you can't focus on something, if you are inattentive, if you're impulsive, it's going to make learning harder for you. Oppositional defiant disorder, again, not being able to follow within the guidelines that we as a society have set for doing things. Conduct disorder, that's a behavior problem. Anxiety disorder, depressive disorder. What are some ways that you can help children who have ADHD? Medication sometimes is helpful. We all have heard of Adderall, or what's the R one? Ritalin, right? Those have made important changes in kids' behavior. Behavior management, helping children see how they are, how their behavior is not working appropriately, right? Medication, we talked about that. But of course, there are side effects to those things. So, Adderall, Ritalin, they can cause weight loss, increased blood pressure, trouble sleeping, whatever. Special diet. They've been talking about diets as a way of controlling attention deficit hyperactivity disorder since I was a kid. I can remember when I was a kid, there was a kid who, it was just called hyper then. He was hyperactive and he had to drink pineapple juice all the time. I don't know if it made a difference, but some people think that it does. And then being very intentional and specific about behavior management. So telling exactly the behaviors that you want to see, rewarding, making sure the environment isn't promoting inappropriate behavior or challenging behavior, planning things so that children are not inappropriately labeled. So if you're planning activities that are not developmentally appropriate for the kids that you're working with, they may show signs of being having attention deficit hyperactivity disorder. If you're doing something that they're not interested in and they're not following along, it may not mean that they have ADHD. It may mean that your activity was not appropriate for them. Learning disabilities are just what they are: trouble learning because of a variety of issues. So trouble using language, writing, trouble with spelling, math, right? So the way you learn, you have difficulties. Okay. Um, Learning disabilities are not the result of a hearing visual or motor handicaps, emotional disturbance, environmental, cultural, or economic disadvantage, or second language learning. So it's not a learning disability if you're blind, because there's a way for you to figure that out. An English language learner doesn't have a learning disability. They're an English language learner. Okay. Okay. And then various rulings on what is or is not a learning disability, right? So children who come from a lower socioeconomic status may not be learning disabled just because of their socioeconomic background. Okay. How can you predict learning disabilities? Watching the child, matching the observation to performance measures. So, making sure that you're seeing that it's a consistent difficulty, right? So, reading is always a consistent difficulty. That's what makes it a learning disability. One time when a kid is having trouble reading is not a learning disability. Learning disabilities have to pertain to skills children will need in school, and they're going to need opportunities to practice their skills. Okay. Sensory motor difficulties are what it sounds like. You don't have good control of your body. Okay. That's gross motor, poor balance. You can't do cross lateral or bilateral movement. So it's hard for you to do something over here with this side of your body, and then difficulty with spatial orientation, right? So those are just, difficult body movement stuff. And then fine motor is when I can't use a zipper or cutting or using a pencil, right? Okay. Cognitive disorders, trouble organizing thoughts or processing information logically. Abstract thought is difficult, poor memory, problems with generalizing information. Again, it's not a one-time thing. This is a consistent over time. You're seeing this again and again. It makes it a learning disability. And then there are very specific parts of your senses that fall into learning disabilities. So if you have trouble with visual perception or auditory perception, you can't see things well, right? That can be a learning disability. Language delays, social skills delays. Response to intervention is a program that is basically helping a child from where they are to where they need to be. So it's helping a child scaffolding, really. So a child is here in his language development. What do you need to do? What intervention do you need to do to help them get to the level that they need to be at? So there is intensive. So in a classroom, you're going to have group interventions that are for the whole class that you're going to do. And then you're going to have short-term and targeted ones. And then you're going to have intensive just for that child. Again, look in your book because there's a lot of information about this. And if you have a child in public school, who has any learning disabilities or delays or anything, behavior problems, you've probably heard of response to intervention because it's used in most public schools now. It is a plan for working with children, monitoring their progress, and families are involved in it. Consistency, and breaking things up into smaller chunks are really important parts of working with kids who have learning disabilities, and also making sure that your environments, the classroom, and environment isn't just the classroom, environment is the schedule, the way you interact with children. That's all part of the classroom environment. Making sure that that's developmentally appropriate for children. Are you talking to them in a way that's appropriate for them? And are you talking to each child in the way that's most appropriate for them? Behavior disorders. Behavior is extreme, chronic, and unacceptable. Again, a behavior disorder means that a child's behavior is beyond what is regularly determined to be typical, but it's extreme. It goes on and on. It's not just one time, and it just can't work in the classroom or in a relationship or whatever. So they say behaviorally disordered. A child is behaviorally disordered because it's person first, right? That child is behaviorally disordered, not that is a behavior disordered child, right? Um, okay. Emotional or behavioral disorder means a disability characterized by behavioral or emotional responses in school so different from appropriate age, culture, or ethnic norms that they adversely affect educational performance. So it's not a kid who complains a lot. It's a child who cannot control his emotions or behavior so that he can coexist with other children in the classroom. And as you might expect, they can coexist with other disabilities. So a child could have a physical disability that manifests in an emotional disorder as well because they're frustrated about their physical disability or whatever. Okay. So there, I'm going to keep going. 1% of school age children are identified with serious emotional or behavioral disorders. So it's not nearly as many as you would think. There are behavior problems, and there are kids who have behavior problems, but that is not a behavior disorder. Okay. Um, when children continually behave in a way that is inappropriate, that's when we need to look at, is this something where we need to intervene? Depression. More and more kids are depressed, younger and younger. And we need to think about how we reach out to those kids. Anxiety, same thing. And Lord, this is the most anxious time many of us have ever lived through. And so, those of us who are in a position to have interaction with children at this point need to be very conscious of, they don't understand what's going on in the world. And as much as we don't understand, we need to be able to help them um, process and understand and think about those things that we're afraid of and that are causing us to be anxious. Autism. So, autism spectrum disorders are usually present by age 3. And the good news is, if you catch an autism spectrum disorder in early childhood, the effects later on will not be nearly as severe. So, um, so many of the autism spectrum disorder interventions and therapies are actually things that we're doing with young children, but they're much more intentional and specific. And so there's almost a kind of intuitiveness to working with a child with autism if you understand how development works and how early childhood, how to work positively in early childhood. Okay, so autism spectrum disorders, deficits in social communication and social interaction. So children who are young, who are not interacting with others consistently and appropriately, um, or communicating, those are children that we need to look at. One early indicator of an autism spectrum disorder is a baby who's not catching your eye, who's not responding to you, looking at the same things, joint gaze. Um, Often that can be an indicator of an autism spectrum disorder. Now, does that mean that if your infant doesn't look at something one day when you point at it, that they need to be tested or, need to be start therapy right away? No. But what it means is, when you see these behaviors consistently, when you see a child who is just not communicating with the people around him consistently, that's when you need to be worried. Another thing that is often an early indicator is really specific and focused and obsessive interests in things. So, and again, some kids are just super interested in things and learn all about it. Some kids, there's a different, like it's the only thing that they can think about. Autism is more prevalent in boys than in girls. Identification is increasing. So, what we say, the instances of autism are increasing. Part of that is because people are more aware of it. People are looking for it in younger children, and so just more people are being diagnosed with it. It's not necessarily that there are more people with it like than there used to be, but that there are more people who are diagnosed, if that makes sense. And most more children are being diagnosed by age 3, which is great because then you can start implementing those therapies and interventions that will help them immensely as they develop. Advances in autism research. So there are some genetic links, mutations seen in children of older fathers, slight association with mother's age. Pesticides may increase the risk of autism. High levels of air pollutants during pregnancy in the first year of life may increase risk of autism. But they really think that it's a combination of a variety of things. And we have ruled out the idea that vaccines cause autism. So all of those people that are anti-vaxxers, it'll be interesting to see what happens when there's a coronavirus vaccine, if people will still refuse to get vaccines then. So things that might accompany autism spectrum disorders: intellectual disability, seizures, Fragile X syndrome, tuberous sclerosis. So there often it's not just autism, it is other issues as well. And then there are different forms. So Rett's disorder is usually diagnosed in females. And what happens is there's 18 months of regular development, typical development, and then they start to lose abilities. Okay. ADHD is a form of autism spectrum disorder. So, what are some interventions? You need to go into your book and look at this. Applied behavior analysis is really looking at a child, figuring out what the triggers for different behaviors are, and then helping them react to those triggers in the right way. Read through your book on this. Discrete trial training, which is sort of practicing things. And the best approaches to intervention for autism are individualized. So the best thing that you can do is find a therapist or a provider who's going to work with your child, who understands your child, and figures out the best way to work with them. Some other interventions are dietary, removing heavy metals from the bloodstream. Some of these things work, and generally, if you do those things, you also need to do them in combination with intervention, because a lot of times what works best with a child with autism is to teach them how to respond to things, right? Um, Being very intentional and very specific about what behaviors are expected. Okay, eating and elimination disorders. Pica is craving of non-food items. Some children do this. Soiling and wetting. What could be the causes of a child's potty training issues, right? So it could be a physical thing, it could be a mental thing. There are a variety of things. Um, Remember that behavior problems are not the same as behavior disorders. So a behavior disorder is a chronic, unusually extreme behavior problem, right? But kids can have behavior problems all the time, right? Um, You should not label a child prematurely. Because a child screams 3 days a week when he comes into the classroom does not mean that he has some sort of behavior disorder that needs to be diagnosed immediately. Give that child another 3 days and see if the screaming stops. Maybe it's just something they decided would be fun to do this week. And that's why it's interesting. Um, in early childhood, you know, if you took a very strict idea of behavior expectations, most children would appear to be behaviorally disordered, 50% or more of the time. It's because they're learning how to behave. So they're doing things that seem really weird and extreme and out there, not necessarily because they have a behavior disorder, but because they're learning how to behave. Okay. And what's most important is how you work with the child to address behavior and learning problems, not necessarily what the child is defined as or classified as. So there you go. That was chapter 8.